It's time for the Russ Belville Show's Cannabis Q&A with Dr. Mitch Earlywine. Dr. Earlywine is a professor of psychology at the State University of New York at Albany and a leading author and researcher on cannabinoids and health, who pins the Ask Dr. Mitch column for High Times magazine. Get your questions ready in our live chat or call in to 971-533-7111 now.
Welcome back, everybody. Half past the hour, and we've been gone on the road for a few weeks and missed our regular doses of cannabis science with Dr. Mitch. So plenty of science to get to. Dr. Mitch is waiting. How you doing, Doctor?
Oh, having a superb time.
It's fall officially now. I imagine you must be having some colorful changing of the leaves up there in upstate New York.
I'm afraid it is hit with a vengeance, so it's also rather cold.
I'll bet it's rather cold. All right. Well, we got a whole bunch of stories that have piled up here in the science desk at 420 Radio that I wanted to get your take on. Before I start, though, I wonder if you have anything new for us in cannabis science.
So my student Mallory Laughlin has a paper coming out in the journal Substance Use and Misuse, basically looking at subtypes of ADHD and which ones are sort of more likely to respond to cannabis. We didn't get to administer cannabis in the lab, but we did get folks' reports, and it seems like folks with the more hyperactive, impulsive subtype are the ones who are getting more relief from the plant and more likely to use it, whereas the stereotypical inattentive type, the folks who really can't focus, don't seem to be the ones who are benefiting as much or turning to the plant as much.
Are there any theories as to why marijuana may seem to help the impulse control and not so much the attention?
I think in part because we do see a lot of THC receptors in that sort of frontal lobe area where that might be important. And there is this kind of hypofrontality hypothesis about ADHD where, in part, perhaps why some of them respond to stimulants too, is that there isn't enough arousal in that area, and so cannabis or other substances and exercise, which also seems to help the ADHD, may be the way to get that area more aroused and then get some of those symptoms to get under control.
Well, that's interesting. You bring up exercise because that was one of the studies I wanted to get to. Maya Salovitz, who always does some extraordinary writing on the cannabis issue out at Time magazine, wrote about this headline was "One Toke, Many Hits. Exercise could trigger additional high for cannabis users," and it was a study out of the Journal of Drug and Alcohol Dependence that found that high levels of THC were higher by an average of 15% immediately after exercise. Did you see this study, and what conclusions should we draw from it?
Yeah, I mean, I love Maya, and I think it's so sweet that she was willing to cover this, and I'm glad this is actually getting out there. Basically, the folks who were in this study would ride this exercise bike and then have their THC measured in their blood subsequent to that ride. And this was, blood sample THC too, not some indirect urinary measure or anything like that. And we do see an average of 15%, but one of the participants actually went up over 40% on one of the metabolites of THC. So we're seeing some intriguing and I think kind of interesting findings. What's curious is we don't get a big measure of subjective high here, in part because it may be kind of confounded with other endorphins that are released in exercise. But what this suggests to me, at least, is that folks who are driving and necessarily subject to some THC analyses in some of these outrageous per se laws we've seen proposed may be at a real disadvantage. And I would hate for our cannabis users to not be getting their regular exercise. I also have to confess that someone near and dear to me has suggested that he's more willing to exercise now that he knows this, and is actually going to make sure he, keeps his THC levels appropriate.
I know when I read the study, all I could take out of it was fat pot smokers like me ought to just sit on the couch if you got a test coming up.
That's sad but true. And unfortunately, the more adipose tissue you have, the bigger this effect is. So, in fact, the correlation was over 0.5, that the percentage of THC change from pre to post exercise with your body mass. So,
and is this just exercise burning fat cells that have THC in them?
It's sad but true, but it seems like that's the most parsimonious explanation.
All right. Well, another study that came up in the news, and we reported on this just this morning, on no detectable association between the frequency of marijuana use and the utilization of health care services or health status. This was in Journal of General Internal Medicine, and it seems to give lie to that prohibitionist talking point that if we legalize marijuana, there'll be all these health care costs we have to deal with.
What's funny is, I mean, we've seen some of this in the economics literature from the early 90s, too, that these folks aren't missing more days of work. They're not ending up in, any other kinds of obvious indices of what could be a problem related to health. And some of the old Kaiser data suggested that unless you're going to go really nuts about modest increases in respiratory symptoms, there's really nothing to point to. And that was those data were gathered long before we had vaporizers available and around. So I really feel like this is hammering that message home that regular cannabis use is not creating health effects that are going to have any inordinate costs.
As I thought about this subject and the numbers surrounding it, after talking to you for years now, I'm always thinking of confounders, things that might mess up the data. And I got to thinking that, I know a lot of people that use cannabis as medicine because they just can't afford health care. And could that be confounding this data a little bit, that the people who are more prevalent to use cannabis just wouldn't be prevalent to use health care in the first place?
Well, so when these data were published, they tried to have some indirect measures of socioeconomic status, but they didn't actually ask about your health insurance. So that might be a contributor as far as that's concerned. But I also feel like in some ways the other end also gets weighed in there. So people who are already medical users are going to be reporting a lot of healthcare use, and then that might sort of sway the averages in the other direction. Years ago, Tom Denson and I showed that there was no link between cannabis use and depression as long as you took the folks who were medical users out, as long as, people with cancer and AIDS and things like that who would be depressed, understandably, weren't in the data. And so I feel like those two sides may both be pulling things in opposite directions, and that, a further study with a closer look at what kind of insurance people had and what kind of health care they used might be very helpful.
I'm glad you kind of mentioned in passing that cancer is depressing. Because a lot of what we get from these prohibitionists is, gosh, we need to take the high out of this medical marijuana stuff. It might have benefits, but we got to take the high out. And that kind of leads me to one of our questions from our chat room. And we take our live questions here in our chat room at Ustream, or you can call in live on the number on the screen. But a Normal Lover wants to know, what direct health benefits does THC alone have, if any? Because, they're touting CBD now, but what are the direct health benefits of THC all on its own?
Well, so we have seen THC alter cancer cells in the Petri dish, and then we've got some really vehement, hardcore case studies of folks who claim that THC has altered their cancer. But the impact on insomnia with both THC and cannabidiol is remarkable, really, really helpful for both onset problems with insomnia and the duration of sleep. It seems to help a great deal. We're just learning some of the other antioxidant properties, and it's the kind of thing where we're not going to have the data until people can be more candid about their use when they're talking to their physicians. So we're really not getting a good feel for any of the other effects, but the anti-nausea is certainly well documented. The interference with vomiting is certainly well documented. And then some of the motion disorders, not necessarily Huntington's, but some of the ones that are more related to small shaking and things like that, we've seen some amazing impact on cerebral palsy symptoms and things like that, and that seems to be very much THC mediated.
And if you've got cancer and are getting a little depressed, it'll get you high.
Sad but true. Oh, my God.
Oh, no. All right. We have another question. John Thomas wants to know, doctors tell you not to smoke for days after an operation because it retards healing. Does that apply to marijuana as well? Or what about vaporization?
Well, it's interesting because the retardation of healing seems to be related to the constriction of the capillaries that is actually more associated with nicotine and other stimulants than it is with THC. But as you might guess, nobody's really done the formal studies. And then the presence of smoke near stitches, smoke itself, not vapor, can be problematic just because here you're getting, basically miniature ashes stuck in between the stitches. We certainly don't want that. But these are relatively minor effects. But, you certainly don't want to be blowing smoke on anybody's recent injuries.
All right. Midwest Bully Brand shouted right through my headphones to let me know that getting high increases your blood pressure, and it's not a good idea to subject your heart to exercise during a high. Is that true? I mean, is there a harm in, like Arnold Schwarzenegger used to get high and pump iron?
Well, and that's all fine in your 20s, but as we're getting on our side of 40, it does seem to be an issue. And some of the few cardiac-related problems attributed to THC tend to be related to this increase in heart rate, but actually a lowering in blood pressure. So everybody has that story about the person who stood up too fast and got all dizzy and stuff after doing a giant bong hit. That combination can be tough on exercise, and I much prefer the idea of, using your cannabis as your reward for your exercising. So get on the bike and work hard, and then make sure you give yourself that reinforcement. Unless
you're a fat guy who has to pass a test. No, just teasing. Get your exercise, folks. It's good for you, and it's good public relations. It makes us look all fitter, which the studies have shown that we tend to be fitter people, don't we, as cannabis consumers?
Yeah, so Mark Gold had those data to suggest that, in fact, the cannabis consumers are less likely to be obese than folks who don't get to get their pleasure that way, so to speak.
We have Left Wing Larry is asking, could it be that exercise kicks the natural cannabinoid system in the body into action, and that's part of why the THC levels are higher?
That actually would show up in endorphins rather than in THC and THC metabolites itself. So although that is happening as well, and is certainly contributing to the subjective effects of exercise, this study literally went for THC and THC metabolites, so that wouldn't account for these data.
Okay. And Gothic Prophet wants to just reiterate, I've just been informed by a doctor that I should exercise and get high afterwards. Doctor's orders, it says.
Well, I am a psychologist and not a physician, so feel free to run any exercise program by your medical doctor.
That's right. Standard disclaimer. And one last question I had to do with, we got into a discussion about the hot air that one is inhaling when one is smoking or dabbing, and whether or not bongs, particularly ice bongs, have any health benefit in cooling that air.
Well, so it minimizes the possibility of heat-related damage to the lungs, and that is a real thing. So those horrible metal one-hitters that are kind of the drug war death toy, those little bitty things that everybody uses to hide at concerts and stuff, those are really hard on your lungs because of the heat. The drawback with the bong is that despite THC not being water-soluble, it actually does trap some THC in there, and it creates this illusion that holding your hits is a great idea because the smoke is no longer hot. In fact, THC gets through to the lung tissue right away, so there's no need for these 45-second lung buster hits, and that's actually just giving the smoke a chance to kind of deposit in the lung there when that's completely unnecessary as far as the subjective high is concerned.
All right. And I said one last, but we actually got one in on the chat room just before I pushed the closer. And is a follow-up from Normal Lover who wanted to know, besides THC, CBN, and CBD, are there any other known majorly beneficial cannabinoids? I know there's plenty out there, but do we know any medical benefits from any of these other cannabinoids?
So we've got cannabidiol, but cannabinol, the other one that's sort of the third most common, is starting to get some more press right now, and may be related to some of the anti-seizure qualities that CBD may also facilitate, but we're just finding out.
All right. Well, thank you so much, Dr. Mitch, once again for joining us here in our Cannabis Science segment. Get our questions and answers. And for the folks listening, yes, we're doing this live. We do it live every Monday here at the 3 p.m. Pacific hour. So you can get your questions in through our contact form at 420radio.org, by our chat room, or just by calling in the number on the screen right there. Dr. Mitch, we'll talk to you next week. Thanks for your time.
Have a great night.
When we come back, we're getting a call from the past. Freddie Farrock is on the line. Stay tuned.
It's simply business. It's simply business. It's simply business. You know why they won't let us grow. It's simply business.
We'll be right back after these messages from our 420 friendly sponsors. Support these advertisers, because their ad money goes straight to the Russ Belville Show. You're tuned into the Russ Belville Show, the voice of the marijuana nation.
It's simply business. It's simply business. It's simply business.